नौसेल।
वंदा में श्रमणी जी।
हाँ, एक तो वो डॉक्टर प्रताप संचेती का अभी तक जो है वीडियो अपलोड नहीं हुआ है।
मैंने
सो
आपको भेजा था ना, कल भी वापस भेजा था मैंने। उसका कौन से वीक में कब है तो मैं अपलोड कर देता हूँ तो उसमें
पिछले से
आप।
पिछले वीक का मंडे का है सब।
नहीं, वो तो मैंने आपको एक तो भेजा है, वो नहीं है क्या?
अच्छा, मैं देखती हूँ कहीं मैंने मिस किया हो तो
पर
मैं
अगर
देख
नहीं
लेती
है
हूँ।
तो फिर मुझे आप एक वो जो कौन से
हो
वीक का है
सकता है
ना,
मैंने,
क्योंकि मैं।
हाँ, मैं देख चेक कर लूंगी उसको तो
हाँ
एक बार।
हाँ।
एंड सेकंड ये है कि मैंने कहा था कि मेडिटेशन के बारे में जो फीडबैक है उसके लिए एक असाइनमेंट अपने को क्रिएट करना है।
हाँ, तो मैं फीडबैक का एक असाइनमेंट क्रिएट कर देता हूँ।
हाँ,
तो इस वीकेंड में सबको दे देंगे।
हर वीक में एक मेडिटेशन देते हैं ना, तो उसमें
हाँ,
उसकी असाइनमेंट फीडबैक
ठीक है।
इन हाफ ऑन वन पेज जस्ट। आज क्लास नहीं है? आज
हाँ,
बात तो चल रही है क्लास में।
और आज कौन है? आज
Hi, Cyril. I'm just gonna share the video once you're ready. Just give me a few seconds.
या श्योर, नो प्रॉब्लम। So I already make you a co-host. So, yep, I'm ready. We can start anytime.
Give me one sec. I seem difficult trying to get the sound to play. I did the problem yesterday. I just figured out what I did yesterday. The sound's embedded in the video, and I think I had to select computer audio. But
Yeah, select with the sound. Okay, whenever you click on a share screen, then there is an also options.
yeah, and I did that yesterday. Somebody guided me, and I just want to make sure I get it right. I'm showing open. When I click the share, it doesn't sometimes give me. It gave to you yesterday in the end, and I don't know how I found it yesterday. option that came up. Now, where did it come up? Let me just see where it came up. Came up somewhere. Remember where it came up
It
yesterday?
came up on the side.
Yeah, I remember seeing it, but I can't seem to find it today. Audio settings.
Did you find it, or do you
No, I'm
have
still
that?
looking for it. Let me send it to you while I'm doing that. Also, maybe you can load it. I sent it to someone yesterday, but I think let me send this
Yeah.
to you so you can do it for me, because I did it yesterday, but I can't remember what I did now.
Sure. Yeah, send it to me. And are you sending me a link on a WhatsApp, or?
Oh, yeah, WhatsApp is the actual PowerPoint itself.
Sure. Send it to
Yes.
me, and then I'll do.
Okay. Anything you need from me?
Samiji, I mean, the same problem. I fixed it yesterday. I've forgotten what I did.
Yes. Yesterday.
No, yesterday it worked, but today I can't seem to get it work again. The audio.
The audio.
Yeah.
Okay.
You know, remember you guided me how to do that yesterday and it worked, but I forgot what I did.
So whatever I've received, I've just received a PPT.
Yeah, that's it. That's the one. If you can put that and present that as audio in it, it'll play
Okay,
with the audio.
perfect. Let me
It's
do.
embedded
Okay.
audio. Okay, thanks.
Sure. Just give me a second. I'm just downloading it rather than directly playing it. So
I said sound share sound that you have to click on that. Share sound. When you share, so in the
no worry,
in the
Vandamiz. Let
right
me
side,
just.
there is-
I'm just downloading it, and then I'll start sharing it.
Okay. Today, Dr. Devendra will speak.
And yeah, and then after I will just also make him as a spotlight so people can see him as well. Okay.
So it's working now, so it'll work. So you'll be okay. I'm gonna share it now. I figured it
Okay.
out. Somebody can help me again. So
And
it worked.
Dr. Devendra, can you sit in a proper position? Could you please sit in proper position so that you can be visible to everybody? You are not in proper position.
Oh, I'm sharing the file, Samiji. It's a PowerPoint sharing.
It may be power, but it's still you.
So today we will be talking about management for common issues affecting women's health based on the previous presentation. So to just review the importance of managing these conditions, one, they can improve quality of life for women. It's important to manage these conditions to prevent long-term complications. Management can support fertility and hormonal balance, and many conditions are chronic but can become manageable with time and correct treatment. So common issues to manage that we'll cover are menstrual disorders, polycystic ovarian syndrome, PMS and PMDD, endometriosis, symptoms of menopause, and pelvic pain. So to start with, managing pelvic pain, painful periods, or dysmenorrhea. Again, to briefly review, one of the most common causes is endometriosis. However, there are many other causes of dysmenorrhea. So first-line options for dysmenorrhea are usually medications like NSAIDs, like ibuprofen, naproxen, or Motrin, heat therapy, and exercise and stretching. All of these have been well documented to be very effective for managing dysmenorrhea. When these medications and other options do not work, we can try to begin to talk about medical options. So usually these options are hormonal management options in different forms. One of the most popular forms is a birth control pill. There's also a birth control patch and a ring, an IUD, and implants. Again, a lot of these different methods, people typically in their head think about them for birth control, and we talk about them very broadly as birth control, but usually for these kinds of different disorders that women go through, it's for management of them specifically, not for the birth control aspect. Other medications and other modifications that have been shown to help with painful periods or dysmenorrhea are things like magnesium supplements and diet modification, especially anti-inflammatory focused. Other lifestyle approaches can be related to trying to have as efficient of a sleep cycle as possible and reducing stress. If with all of these management options, the pain is still severe or worsening, then we would need to evaluate further for underlying causes and talk about other options. Next, we'll discuss managing oligomenorrhea or infrequent periods. Management depends on identifying and addressing the underlying cause rather than just treating the symptoms. For many people, lifestyle factors play a major role in something like oligomenorrhea. So improving nutrition, reducing excessive exercise while keeping a healthy dose of exercise, managing stress, and achieving a healthy weight can all help restore more regular cycles. And these are not only helpful to restore your menstrual cycle, but also support things you can't see, like your hormonal balance and overall reproductive health. Again, hormonal treatments such as birth control pills or other hormone-based options are again used to help regulate the cycles, and they can protect the uterus from problems caused by the irregular shedding of the lining. If oligomenorrhea is caused by a medical condition like PCOS or thyroid disease, treating those conditions directly play a very important part in managing the overall symptoms. Again, that can involve medications, lifestyle changes, or both. And for patients who want to become pregnant, fertility treatments can be used to help trigger ovulation and improve the chances of conception. So regular follow-up, if a person's experiencing infrequent periods like this, is really important to help protect long-term reproductive health. Next, we'll talk about managing menorrhagia or heavy periods. Again, management starts with treating and identifying the underlying cause. Because heavy periods usually result from hormonal imbalances, the first line treatment is similar to other conditions with NSAIDs and something called tranexamic acid. NSAIDs, again, being medications that include ibuprofen. The cause of menorrhagia, however, can be from a lot of different things beyond hormonal imbalances. There can be causes related to structure of the uterus. So if you've heard of conditions like fibroids or uterine or endometrial polyps, it can also be caused by thyroid disease or bleeding disorders as well. So treatment is extremely individualized for menorrhagia. So while NSAIDs and tranexamic acid can all help extremely well for patients experiencing heavy bleeding, as they both can decrease blood loss. Other medical management options include hormonal treatments like birth control pills, progestins, meaning medications that include a type of progesterone analog, and hormonal IUDs are very commonly used. IUD being that T you see in the picture. That's a long-term option that is placed into the uterus. These methods can help regulate cycles and thin the uterine lining, which often and usually can lead to lighter periods. The goal is always to help thin the uterine lining for patients undergoing treatment for menorrhagia. Again, for patients with heavy bleeding, usually they also experience anemia, and typically that's due to iron deficiency anemia. So iron supplementation is necessary to help improve overall health and energy levels. So now we'll briefly touch on procedural and surgical management options for menorrhagia. So again, like I said before, sometimes the cause for abnormal uterine bleeding can be structural, so things like fibroids, endometrial polyps, a condition called adenomyosis, enlarged uterus. All of these are structural causes and can usually be managed also with a procedure or with surgery. These options usually will be discussed if all first-line management options have failed or if there are other reasons for getting surgery. So when providers talk to you about this, they'll typically go through all of the different options and talk about last case scenario if we would need to proceed with a procedure or surgery. These procedures are usually not long, can be very quick, and can sometimes be therapeutic as well as diagnostic. So it's important to get regular follow-up to help monitor these symptoms, to adjust treatment, and to prevent complications. With proper management, most people experience significant improvement in the quality of their life. Now, again, just to briefly touch on, fertility goals are especially important to discuss for this condition, as some treatment options are not appropriate for patients who want to become pregnant. So shared decision making between patient and provider is essential to ensure that whatever approach we end up choosing aligns with personal goals and medical needs of the patient. Next, we'll talk about management of premenstrual syndrome and premenstrual dysphoric disorder. Both of these conditions can be incredibly frustrating for patients, as usually they are not talked about as much and typically are normalized in the society, so a lot of patients don't seek care for them. However, there are a lot of different management options for them that can be very effective. For many people, lifestyle changes make a huge difference in their life, so finding ways to get enough sleep, regular exercise, and finding ways to reduce stress, like relaxation techniques or even seeking counseling or therapy, can all help with the physical and emotional symptoms that go along with PMS and PMDD. Eating a balanced meal or balanced diet, cutting back on stimulants like caffeine, salty foods, and alcohol can also reduce bloating and can help with mood changes during this time. When symptoms become more severe and a condition has started to look more like premenstrual dysphoric disorder, medications can start to be discussed and start to become helpful. Over-the-counter pain relievers can significantly help with cramping associated with PMS or PMDD and with headaches. For mood symptoms, especially in premenstrual dysphoric disorder, antidepressant medications are often very effective and need to be taken every day or sometimes even only during part of the menstrual cycle. So things like SSRIs or antidepressants are first line for this condition. There are many types of SSRIs and it can be individualized for each person. Hormonal treatments, such as certain birth control methods, can also help stabilize hormonal changes for some people, though responses can vary. So again, usually for PMS and PMDD, most patients like to try with something like the pill or with the ring or the patch as options I've discussed before. It's very important to seek medical help if symptoms of PMS or PMDD are affecting your life or interfering with your work, with your school, relationships, or daily activities. They are very real medical conditions and treatment can greatly improve the quality of life. Next, we'll talk about management for PCOS or polycystic ovarian syndrome. It's a very common long-term hormonal condition for patients, and it's almost considered a chronic condition. But with proper management, most people can control symptoms and protect their overall health. The mainstay of managing PCOS is by cycle regulation. So medications are commonly used to help regulate cycles and hormone levels, as we talked about before. Certain birth control methods like the pill or combined oral contraceptive pills you might hear can help make periods more predictable and therefore can help reduce the other symptoms that patients with PCOS experience, like acne and excessive hair growth. Other medications can also improve how the body responds to insulin, which is a very important part of PCOS for many people. As I said before, many people who have diabetes may also develop PCOS. So medications like metformin, which many of you might have heard to be used for diabetes, are also sometimes prescribed for patients with PCOS to help with insulin resistance. Also, for those patients who experience acne or excessive hair growth, there are additional treatments and specific medications that can help, or topical therapies and cosmetic options like laser hair removal. If pregnancy is a goal, fertility treatment can help stimulate ovulation. Many people with PCOS are successfully able to become pregnant with appropriate medical support. Letrozole is a medication you may have heard of, which is a very common ovulation induction medication for patients with PCOS. There is also one called clomiphene, and also metformin is very often used in conjunction with those medications to help give a patient the best chance to have a healthy pregnancy. PCOS is also linked to long-term health risks such as developing diabetes, high cholesterol, and heart disease. Because of this, regular checkups, regular blood tests, and support are very important. With individualized care, people with PCOS can lead very healthy, active lives. Next, we'll talk about the treatment of endometriosis. Again, endometriosis is one of the most common causes of pelvic pain or dysmenorrhea and is a long-term condition. And it's very important to be clear that there's no cure for endometriosis. However, there are many management options that can significantly improve people's quality of life with this condition. The main goal of treatment is pain control and improving quality of life. Pain medications like anti-inflammatory drugs like NSAIDs are often used to help reduce cramping and pelvic pain, especially during periods. Hormonal treatments can be commonly used to slow or stop the growth of endometriosis tissue. Again, to recap, endometriosis is when the tissue similar to the lining of the uterus is being found at other places where it shouldn't be, and therefore many of these treatments are targeted at slowing or stopping the growth of that tissue. These treatments can reduce inflammation and help make periods lighter or stop them altogether, which often can help with pain. So hormonal birth control options, again, like the pill, patch, the ring, IUDs, are progestin-only methods. IUDs and implants are very commonly used for this condition. While most patients gain a lot of support and improvement just with these first-line methods, sometimes it's a very severe condition for some patients and therefore can require surgical intervention. So as I was saying before, endometriosis is a condition that can only be diagnosed with a pathologic sample. And usually surgery is recommended to remove endometriosis tissue for patients experiencing intense pain and it starts to affect their life significantly, or if symptoms are not improving with medication. Surgery can relieve the pain and improve fertility for some people. Although symptoms do and can return over time, so it's important to remember that it's, again, not a cure, but can be a very significant fix. If someone wishes to become pregnant, fertility support and specialized care may be needed as endometriosis can affect fertility. There are many endometriosis experts that exist now and are very helpful for patients who are trying to achieve fertility. Ongoing follow-up is very important with a provider for this condition as well. A very personalized treatment plan can help balance symptom relief, side effects, and individualized goals. Next, we'll talk about perimenopause and menopause and how to manage these symptoms. As they're both natural life stages, most people think they just have to go through it and experience these symptoms, but they really can affect daily life, and there are many management options that can be used. Management of these conditions usually focuses on reducing symptoms and supporting long-term health. Lifestyle changes are one of the first steps for these conditions. So things like regular exercise, healthy eating, good sleep habits, and stress management can help a lot with symptoms like hot flashes, mood changes, and weight shifts. Avoiding triggers like spicy foods, caffeine, or alcohol can also help reduce symptoms for many people. When symptoms become more bothersome, so things like hot flashes, night sweats, and mood changes, medications can be very helpful. There are hormonal therapy options like estrogen and progesterone if a patient still has a uterus, and there are non-hormonal options like SSRIs, SNRIs, gabapentin, and clonidine. SSRIs and SNRIs are commonly used for mental health disorders like depression and anxiety, but can be very helpful for perimenopause and menopause as well. The hormonal treatment is important to think about, especially as patients go through perimenopause and menopause. Their hormone balances are changing abruptly, and it's really important to note that replacing those hormones can be very useful for patients. However, there are specific patients who should not use hormonal therapy, and it's important to talk to your provider if you have any risk factors before talking about hormone replacement therapy. So the important things to think about are any history of estrogen-sensitive cancers, so any history of cancer of the uterus or the breasts or the ovaries, history of clotting disorders, any history of stroke or heart attack, or uncontrolled high blood pressure. Another common symptom is vaginal dryness. There are a lot of medication and non-medical management options for vaginal dryness. Vaginal estrogen is a very common and very helpful medication for patients going through menopause and experiencing this symptom. It's a medication that is in the form of a cream and is used as a device that you insert into the vagina for every night for 2 weeks and then twice a week from then on. It can reduce the risk of also getting urinary tract infections, yeast infections, and can be very beneficial for patients. There are also different moisturizers and lubricants that can be very helpful as well. Finally, bone health and cardiovascular health are really important to think about as well, especially for bone health. Oftentimes, we recommend for people going through menopause to start calcium and vitamin D, to start doing weight-bearing exercise if you have not already been doing that as well, and to always get regular health screenings, especially for cardiovascular health. Because experiences of perimenopause and menopause vary widely, care again should be personalized. We'll also talk next about managing pelvic organ prolapse. Again, that's when the pelvic organs like the uterus or the bladder or even sometimes the rectum can start to fall down and start to feel very heavy or pressure or a bulge. Usually management of this condition starts with lifestyle changes, so things like maintaining a healthy weight, avoiding heavy lifting, and avoiding constipation. They can reduce the pressure on pelvic organs and help improve symptoms. Pelvic floor exercises, which are also called Kegel exercises, can be very beneficial and help strengthen the muscles that support the bladder, uterus, and bowel. These exercises are highly effective for mild prolapse and can help prevent progression. Bladder training is another management option that can help manage symptoms related to pelvic organ prolapse, like urinary incontinence or leakage of urine. This usually involves scheduling bathroom visits and gradually increasing the time between bathroom visits to help improve bladder control. In some cases, you might have heard of something called a pessary, and these are images of them on the right. They are small devices that are very, very effective to help with the symptoms of pelvic organ prolapse. They're small, removable supports that are inserted into the vagina to hold the organs in place, and they can help patients avoid or delay the need for surgery. Medications can also be used to help reduce the symptoms related to pelvic organ prolapse, like urinary urgency, frequency, or leakage. If all of these approaches are not enough, surgery may be recommended to help repair the prolapse or treat the subsequent incontinence that can occur. There are many types of surgeries that help to manage prolapse, and the type of surgery will depend on which organs are affected, how severe the symptoms are, and for the personal goals of the patient. Again, regular follow-up for prolapse is very, very important. Next, we'll briefly talk about holistic and lifestyle options to help support these conditions. So first of all, nutrition, as you have heard, is a very important mainstay and management options for many of these conditions. Iron-rich foods, healthy fats like omega-3s, ensuring adequate protein, limiting processed sugar, and especially remembering that alcohol has a lot of processed sugar, and supporting gut health are very important. There are supplements that are often used and we'll often see women use, like vitamin D, magnesium, omega-3s, B-complex vitamins, and even selenium. It's very important to regularly move your body to help support your metabolism. Strength training is extremely important to help bone and thyroid health, and also can help reduce the stress hormones that can affect all of these conditions. So just to review the importance of preventative care in women's health, it's very important to go for an annual wellness exam, whether that's with a primary care doctor or with a gynecologist. Cervical cancer screening is extremely important from the age of 21 to 65, sometimes longer depending on what kind of results you've had, usually every 3 to 5 years depending on what kind of testing you've had. Breast cancer screening annually from the age of 40, sometimes earlier depending on history, is extremely important. Bone density testing from the age of 65 is very important, as we talked about how bone density can be affected once women hit perimenopause and menopause. Colonoscopy is important from the age of 45, and routine blood work.
Yes, hi. Okay. Does anyone have any questions? That was the second part of the series for women's health by Vaishali Mehta. She was going to try to join today. I don't see her online. I'm just reaching out to her to see whether she's going to be able to join. If there was any discussion that we wanted to have regarding the women's health. But if there are questions, I can always forward them to her and get answers back. If there's any specific questions, anything that somebody doesn't understand, please let me know.
Hi, Naina.
Yes, I'm here.
Hey, quick question. Is cervical screening the same as pap test?
Yes,
That's the same thing, right?
that's the same thing. Yes.
Okay. got it.
The pap smears. Yes.
Pap
that's
smears, yes.
Yes, that's
Okay.
the same thing. Yeah.
And you do that every 2 years, right?
Every 3 years, she was saying.
Oh, every 3 years.
Yeah, but if there's been anything that's been found that's abnormal, then you might have to do it more frequently.
Okay.
Yeah.
And the PMS and the PM something else?
Yeah, PMS and the PMDD.
Yeah, what's the difference? PMDD?
So that was a premenstrual dysphoric something syndrome. Hang on, I'll tell you. So it's just a more severe premenstrual dysphoric disorder. So premenstrual syndrome is what is commonly what everybody gets. Like, you know, when you get when they talk about they're getting the feelings of bloatingness, and sometimes you get pain and cramp and things like this. But if this gets much worse, then it becomes the dysphoric disorder. And usually the dysphoric disorder has an element of hormonal imbalance with it in the brain. So that's why they say antidepressants are often used, because often it goes into having some kind of mood disorder in there when it goes to the dysphoric disorder. But it's just this, so it's more a severe form of the PMS.
Okay.
Yeah.
Thank you.
Vaishali talked about Kegel's floor
Yes.
exercises. Are you going to cover those sometime, or what are they?
Yeah. So the Kegels exercises are the exercises that strengthen your pelvic floor muscles. And I'm hoping that maybe you know, when we do that mole band, when somebody talks about that, like squeezing from the bottom and pulling everything in, that's exactly what a Kegels exercise is. So I think that when we do the asanas with Ramesh Bhai on Friday, he probably will cover some of those for those exercises. Yes, it's not anything more than that. It's the same thing, just putting your muscles in.
Okay.
Okay, did Vaishali join? No, I didn't see her on here. It's being a busy OBGYN doc resident. That's she says she can join in 10 minutes. So
This is a Kegel, so very close to what we do.
Okay, yeah, this is like Setu Bandhasan.
Correct. See, you're an expert already. We're gonna go over the science, you know, the yoga science
Okay.
on these diseases, which probably includes this tomorrow. Then somebody's going to do the meditation part, and then on Friday, Ramesh is going to go over the yoga part.
The
So
yoga
a
posture.
lot more to offer than this.
Okay.
yeah,
I think
this is actually a bridge pose. Yeah, Setu Bandhasan. I don't
Mm.
think those are the Kegel exercises. Maybe part of the Kegel exercises. Yeah.
yeah, this is part of the Kegel. Yeah,
Yeah.
part of the Kegel exercises.
Yeah.
Mhm.
Perfect.
So yeah, and I think the reason that this is an important topic, women's health, is
It is.
the impact in women is huge. You know, it's understated because it's hush hush, but you know, I think
That's
I'm
right.
glad we're covering it because it's not openly expressed. It's very, you know, with a male, it's very hard to express these things. And generally, the male response to this is it's common, not interested. You know, I'm just saying in a general sense. We want to brush it under the rug, want to talk about it. It's embarrassing. I think realistically, this is so common. Many of our female members of families have it. It's very, very common. So we want to induce this empathy and realize how really serious this is, how much therapy exists. And so, you know, and so you can imagine when you have so you're teaching somebody with this, if you have some understanding, they'll be open and you can actually give them poses that might, and push might help. So it's just the reason to learn about the treatments more so you're aware, not so you memorize, but you respect that.
Yeah,
because of importance. And so we're not going to test you on those, but I did feel, and we'll decide at the end if this is helpful, but if you know the whole gamut in a nutshell, you're better able.
I agree. It's very important because as instructors, we will have a very diverse audience, participants, and knowing if somebody is going through these conditions, knowing having the background, and so we can, you know, genuinely empathize with them and either instruct accordingly. If we know, then it's probably mutually respectful on both sides, right? So if somebody is teaching from ignorance or just it's different than knowing what we're talking about.
Very true. So Vaishali says she can join in 10 minutes. So I don't know whether we want to wait or...
We can do the meditation and then she can join after that.
Yes. Yes. So I'm ready. Sheetal or Shivani, who is ready?
Vandavinod Swami Samriji.
Okay. So you are ready?
Ji Vandavi.
Okay.
So we're going to do Sharir Preksha. And I think we'll get up and do a stretch, stretch our body once. Fold our arms and stand on our tippy toes. Do that one more time. Let's select a comfortable posture. Padmasan, Adh Padmasan, Sukhasan or Vajrasan. Keep your palms on your lap, below your navel, facing upwards. If you're doing the Vitarag Mudra or the Gyan Mudra, touching the index finger with the thumb. And close your eyes softly without any pressure. We'll chant Om mantra 3 times. Om. Om. Utsarg. Total relaxation. Keep your body steady and relaxed. Keep your body stable like a statue. No movement at all. Suggest your body to relax, relax, relax. Concentrate your conscious mind at the big toe of your right foot. Let your conscious mind travel throughout that area. Relax the big toe and the other toes of your right foot. Moving up, relax your calf muscles, the ankle, the calf muscles, the thigh, and the hip joint. Feel the relaxation on the entire right leg. Relax, relax, relax. Now move your attention to the left big toe and suggest to relax. Relax the left toes, the ankle, the calf muscle, the left knee, and the left hip. Now move your attention to the center of your body, the abdomen, the other organs, and the back. Feel the relaxation in the entire midsection of your body. Relax your lower back, your mid back, and your shoulders. The arms, bring your attention to the top of your body, your neck, your face, and experience the entire body is fully relaxed. Now we're going to experience the perception of our entire body by moving our conscious mind back to the big toe of your right foot. Experience the subtle vibrations of vital energy there. Perceive the tissue and each and every cell in your big toe of your right foot. Feel the subtle vibrations of energy without any like or dislike. In the same way, perceive each and every part of your right leg, including your toes, the sole, the heel, the ankle, calf muscles, the knee, the thigh, up to the waist, and experience the subtle vibrations of vital energy there. Perceive each and every part of your left leg, the big toe, the other toes, the sole, the heel, the ankle, calf muscles, the knee, and the thigh. Experience the subtle vibrations of vital energy there. Now perceive the lower abdomen below your navel. Experience the subtle vibrations of vital energy, free from like and dislikes. Perceive each and every organ of the abdomen, the right kidney, the left kidney, the large intestine, the small intestine, the pancreas, the spleen, the liver, the stomach, and the diaphragm. Perceive your chest and the right lung, the left lung, the heart, throughout your back, the spinal cord, and the neck. Perceive the vital energy in your right hand, the thumb, the fingers, the palm, the wrist, elbow, upper arm, and up to your shoulder. Now perceive your left hand, the thumb, the fingers, the palm, the wrist, the elbow, the upper arm up to the shoulder. Perceive your throat and the vocal cord. Perceive the chin, the lips, the tongue, the right cheek, and the left, the nose, the ears, and your eyes. Feel the sensations and the vital energy. Perceive your head and each and every organ with deep concentration and awareness. Perceive your whole body together. Focus your conscious mind on the entire body from top to bottom and bottom to top. Bring it down quickly from your head to the toes in the same speed. Perceive the whole body and try practicing holding your breath in between. Experience each and every part, each and every cell of your body is vibrating with the flow of vital energy. Experience the flow of current inside the body, the touch of the clothes, feeling of perspiration, sensation of itching, any kind of pain, or whatever sensation taking place there, perceive them without like or dislike. Continue the inner journey slowly. If you feel pain or blockage in any part of your body, stay there for a few seconds. Just know and perceive them without like and dislike. Undertake the inner journey of the conscious mind and the vital energy together from the toes of your feet up to the top of your head. Experience your consciousness has fully awakened from feet up to the top of the head. Experience the flow of vital energy in every part of the body. You're going to take 3 long breaths and experience every part of the body has become active. We'll conclude the meditation with 3 long breaths. Let's recite the Om mantra and slowly open our eyes. Om. Now rub your palms and bring it on your eyes.
Thank you, Sheetal. It was wonderful session. You have given very good session.
Thank you, Vanda.
Now it is clear that how we have to give session. So it was good. Now Dr. Vaishali is there. Or still she is not here. Dr. Naina.
Dami Somniji, I'm texting her. She said she was going to try and join. But I didn't see. I told her that we're just doing some meditation first. So yeah, she's going to join. Let me see. We already sent her the link, so she'll join.
Your tone was really good, I have to tell you. It was very calming. It's very relaxing. I appreciate it.
Yes, very good session.
Nice
Thank you.
presentation.
We already sent her the link, right, Devendra?
Vaishali ji.
Hi.
Here she is. Can you? Where are you, Vaishi? You there, Vaishi?
Is it
Yeah,
okay?
she's there.
I'm just moving around, but I'm here.
Okay, do you want to show your face or no? Jai Janendra, Vaishali, everybody was very happy with
Jai
your
Janendra.
presentation. It was
Great
really good.
presentation.
Oh, good. Okay, give me a second. I'll put my video on for a minute.
Yeah, then you can also see everybody.
Hello.
There you are.
Hi.
Hey. Okay, so people can fire away now. She's the expert.
Oh, I don't know about that.
I'll start with the one question that Rakesh Bhai had was about the Kegel exercise.
Mm-hmm.
Yeah, what exactly it is and what it entails.
What it entails and when should one do it?
When would you be recommending it? Yes.
Well, actually, they recommend doing it anytime, even from now, like any age, anytime, because it's very effective to strengthen your pelvic muscles even before you. If you are deciding to be pregnant before you're pregnant, it's good to have strengthened them, and then definitely after. And you can do them. They usually recommend patients to do them, like if they're just waiting for a bus or if you're sitting on a train, then it's a good time to do it when you're not really doing anything else. And it's essentially like if you were to feel like you're trying to attempt to void, and then if you're stopping that stream, that's what a Kegel is.
Like stop going to pass urine.
Right.
Yes, you squeeze the bottom
Yeah.
end.
Mm-hmm.
Yeah. Okay.
So you should be, and we usually say do like 10 at once because it can be actually kind of tiring. And then, yeah, anytime, and anyone should be doing it whenever they get a chance, actually. Any woman.
How
Okay.
about men? Who are men? Not men?
I don't know anything about your pelvic floor, sorry.
And then Sheetalati had a question about what's the difference between PMS and PMDD?
PMDD is just a more severe form of PMS. Like both shouldn't be considered normal, but PMS is definitely more common. PMDD is if it's really significantly altering your life to the point that your like social relationships are being affected. You can't do your day-to-day activities, whereas PMS is you can still function, but it's harder, basically, is a simple way to put it.
Okay, so when it says it's dysphoric, is there element of emotionality more in the PMDD? Like, how do you know you have PMDD and rather than PMS?
So there's a lot of clinical criteria, but really it's more of you kind of can tell when someone has PMDD because one, it usually is associated with a history of depression or anxiety, and that gets acutely exacerbated on your menses if you already are suffering from that. So then it's almost like you just cannot function at all during those 5 to 7 days, and these patients like are not able to go to school, they have to stay home, they're not able to work. They get into arguments easily, like their emotions are very labile. It's kind of a hard diagnosis to make, honestly. It's not an exact, it's more of just like an overall clinical diagnosis. But either way, it doesn't really matter because they're both treated similarly and both are covered. It doesn't matter if you diagnose one or the other, you still would get covered for the antidepressant if that's what you need. Like insurance companies cover them the same.
Okay. All right. Anybody else?
I had a question about menopause. So the onset starts like for different people like between 45, but then it can last for many years.
Yeah. Menopause. So there's perimenopause and menopause. And typically perimenopause usually starts if you're starting to notice your periods are lighter or irregular. And they used to be very regular. And then typically your periods will just stop. And when they say menopause can last for years, it's more so the symptoms of menopause, because perimenopause, you're still usually getting an irregular period. But then when you hit menopause, you shouldn't be bleeding at all. And if you have any bleeding after a time of no bleeding, then that's abnormal and should be evaluated to rule out any sort of malignancy.
But the only way to know if your hormones are not in line when you are done with menopause is just by like blood work or
and symptoms, really. People who are postmenopausal, when you're going through menopause to postmenopausal, it's almost like it's a very slow transition. It's more so based on subjective symptoms, like the hot flashes will stop, like the frozen shoulder syndrome will stop, and then it'll just be their new normal. Like they won't have these symptoms anymore. Sometimes people still do, and then that's when we can use hormone replacement therapy as long as there's no history of breast cancer, uterine cancer, any like contraindication to estrogen. Then we can use hormone replacement therapy for those people, even at a higher age. We use it. So.
Thank you.
Okay.
So when we went to visit Vaishali, they go to work before 7. They get home at 8 if they're lucky, and then they've maybe 45 minutes to eat. Then they look at their records, and by 9:30 they're back in bed. It's like a ridiculous schedule. So I appreciate your time. We should really realize how hard this is.
Yeah. No, I'm glad it was well received.
Well, I think unless we make it a big issue, we don't learn about it, right? I want people to understand it's real, it's important, and then when we get to the yoga part, they'll appreciate their subjects and do the right thing, respect their symptoms or whatever they have. Because sometimes when men don't understand it, it's a little bit cliche, but it's true. If men don't understand what women go through is important they know, all of us. So I think that's kind of why we put that in there. And I think I'm glad we did. And we have a lot of research on, which I'm going to present tomorrow. I'll show you the slides on yoga meditation, how it's helped. Good RCTs. So we'll touch on those and maybe some poses that help. Some look like giggle, actually. Some very much like Muladhara is exactly the same. It's just an ancient version. So I think we can build on this depression ones we have, sleep ones we have. So we've got a nice cocktail of poses and activities in pranayam that would work or has been studied. So we'll present that tomorrow.
And one last quick question, Vaishi. Pap smears are every 2 years or every 3 years?
Pap smears are typically every 3 years, but there's some caveats because some like doctors won't do certain testing of the HPV virus with it. So if your doctor is doing a pap smear with HPV, which they should be doing, then can be every 5 years if they've always been normal. But if they're not, and it's just a pap smear alone, then it has to be every 3 years. And it depends on your history too. That's just a general.
Yeah.
General.
That's what you were saying. Okay. Okay. Vandami Somniji, anything else that we need, Vaishali?
Okay. So I have heard Vaishali's both the lectures. They were wonderful, and her presentation was excellent. Just I want to say that she has rightly added some yoga exercise, meditation, and exercise too with her medical presentation. So yeah, so this is a really very good thing that if doctor says something, then the patient will follow with more seriousness. So that is a very good point, which Vaishali has done. But her presentations were really very excellent.
Samiji, are there any mudras associated with these kind of conditions that can help?
I have to look for all these things, and when my lecture would be there. Right now, I cannot say anything about what Vaishali has said. That I agree, but I have to look for what is the proper mudra for this particular problem.
Yeah. Thursday, there's the lectures on pranayams, mudras, and meditation, Rakesh.
Yes.
Somebody's going to do our homework before then, don't worry.
Yes.
No, the important thing here is we incorporate something new because I think it's important. You know, we don't want to ignore this because up to now we've not been talking about this.
What Acharya Sri Mahapragya ji has suggested, yoga packages for different health issues. So since he has not written anything about that, but there are certain things which we can suggest from other sources. So I will say that.
Okay, Vandami Namasami.
Thank you, Vaishali.
Thank you,
Vaishali.
Vaishali.
It was a good presentation.
Thanks so much.
Instead of being busy, she has prepared both the presentations, and they were prepared very well.
Good, I'm glad. Any other questions you can just send to mom and she'll send them to me. I'll be happy to answer them.
Thank you.
Thank you, Vaishali.
for joining.
Yeah.
Thank you very much, Vaishali.
Bye-bye.
Thank